Good afternoon, everyone. Thank you for joining us. As of this morning, we have 504 cases of COVID-19 in 53 counties in our state. We've completed more than 12,000 tests and have almost 15,000 collected samples pending. Earlier today, we shared that North Carolina has counted our first COVID-19 deaths. It's with a heavy heart that I must tell you that these will not be our last. One person was from Cabarrus County in his late 70s and had several underlying medical conditions. The other person lived in Virginia, was in his 60s, and was traveling through our state when he was hospitalized. This is a difficult time for their families, and I asked the media and their communities, please respect their privacy as they mourn. We know today that a number of patients who are currently hospitalized are seriously ill, and some in critical condition. They are fighting for their lives. And it's awful for their families who know their loved ones are suffering, but because of this cruel and contagious sickness, they cannot even be with them. Today is a stark reminder that we must take this disease seriously. All of us, young and old, employers and employees. This virus can be deadly, and that's why our daily lives have had to change so dramatically. I know it's hard, but it's necessary. In the last few weeks, I've taken significant statewide actions to slow the spread of the virus. We've closed schools, banned social gatherings, closed numerous businesses that can increase the spread of the virus. We've limited nursing home visits, and we have encouraged people to stay home. These actions have been difficult, but necessary to slow the spread. And we know that further action to protect our state will be necessary. We're in the process of working on additional statewide guidance and restrictions that we will be announcing soon. It's imperative that we keep North Carolinians safe while at the same time doing everything that we can to limit the economic impact of this virus on businesses, workers, and their families. These are difficult, deliberate decisions, and it is important that we get them right. There are also important steps that we can take right now to slow a spike in cases that could overwhelm our medical system. Stay at home when you can. Practice social distancing wherever you are. If you are a business and haven't done so yet, get your social distancing and telework plans in place now. Do not wait. You owe it to your employees, and you may need those plans in order to stay open. I want to again thank our healthcare workers who are showing us what courage means. You do your jobs every day, even in the face of a pandemic, to keep us healthy and to save our lives. Our state is grateful to you. Today, we join together as a state to keep those who are mourning in our prayers. Let's also commit to doing our part to slow the spread of this deadly virus. In doing so, we honor their lives while we protect our communities. I'm joined today by Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, Mike Sprayberry, our Director of Emergency Management, Eric Hooks, our Secretary of the Department of Public Safety, and Nicole Fox is providing American Sign Language. Dr. Cohen, I'm going to call on you to share your update.